The main symptom for arthritis of the hip is extreme pain. About 10 million Americans suffer from it, and Laura tells us about a new procedure that could bring some relief in tonight's Health Beat.
Well, Scott, when all cartilage is gone and your hip joint becomes bone on bone, even walking is impossible without pain. Tonight, a new high-tech procedure is being offered locally to help relieve that pain. It's sort of like a GPS system for surgeons who fix hips. It's reducing complications and returning patients to a normal life. Volleyball is a sport that requires jumping and twisting and turning, even for the coach.
As a volleyball coach, you're very interactive with the team, hitting balls, entering balls, serving balls.
But all that came to an end for 57-year-old John Blair, head coach for the Tennessee Tech girls volleyball team, when he developed arthritis in his hip.
Honestly, the last year and a half, it was so limiting. I had to take a kind of a back seat for what I would like to be as a coach on the floor.
As a college and professional volleyball player for years, Blair was used to dealing with aches and pains, but this pain was debilitating.
If you try and push through, now you're getting knifing pain. And then once you get bone on bone, which is where I had progressed to, then you can't stride through whether you wanted to or not.
John Blair needed hip surgery, a procedure some 200,000 people get every year. Mr. Blair's x-ray before surgery shows why he was in so much pain. This is actually his good hip. This space right here, this gray line, means that some cartilage still exists. He's in good shape there. But on this hip, where there's essentially no line, means his hip is bone on bone. Very painful. Since Blair is still young, his orthopedic surgeon at St. Thomas chose to resurface his hip. It allows for a more successful hip replacement down the road.
And so with the resurfacing, we preserve more bone so that if and when that happens, we should have more bone to work with for a second hip replacement procedure.
What's unique is the new image-guided computer program Dr. Morrison used in the OR.
In the operating room, it's like a video game, essentially.
The program allows surgeons to put parts in more precisely. New technology similar to a global positioning system for the body. The best part, it's reducing complications for hip surgery patients.
How we position the components very much determines what our risk of dislocation is. So there, if we put the parts in better or straighter, then we have less risk of dislocation.
John Blair says when he woke up from surgery, his pain relief was immediate. And though he has several months of rehab, he calls the procedure life-changing.
Everything from start to finish has been really just unbelievable.
John Blair is about 80% back to normal. He tried to get permission to go skiing this month, but a surgeon said no. His hip isn't quite set yet, but he feels great. For more information about the image-guided hip procedure and the St. Thomas Joint Replacement Center, just log on to our website and look for Hip Help.